Siam, eye of an orthopedic surgeon. Siam no more a luxury in ortho OT, which at one stage it was a big luxury, which I started with. We all know this very well, it's not a luxury. But we do not know. The cheapest and the best Siam cost difference is 7 to 8 lakhs cheapest. I presume that is the price today. And the most expensive is 40 to 60 lakhs. This is the difference between the two Siams. And those who have used at both the ends, they know very well that there is a heaven and hell difference. When we buy first Siam, unfortunately it is the cheapest quality which we all buy. And we miss out on extreme pleasure of operating with the best Siam ever you have seen, which now I feel is our biggest pleasure. I'll give you the example. I joined Reliance Hospital as a mentor, and I was responsible for buying the instruments and everything. And there, the Siam which we had, Reliance, I'm talking about the Mukesh Ambani's hospital, where the dictum was money no concern, buy best what you can. So they bought the Siam with the tenders. And obviously the tender Siam buying is the cheapest Siam which they bought, which when I operated first, I said, this is the Siam. I wrote to Tarang, who is the chief there of the hospital, that this is a Siam which is about 5 steps below than what I used to work in my nursing home. The one which I worked in Jaslok, where she was the boss, is probably 25 steps ahead of what you have a Siam here. He says, I'm sorry, I didn't know that. So this is what is a tender buying will give you, that most inferior Siam which is there available. So this is how slowly we bought the best possible Siam. This is the best possible Siam which you can have. There is a screening for the person who is doing it, and these are the 2 screens which can be adjusted very well. These are the possible ones. My journey with Siam, as most of you know, why I was probably the first one to buy Siam in a private sector. I used to go to American Academy, and they would only talk on a Siam, interlocking, nailing, and Siam, and which we had nothing. We had those X-rays, 2 X-rays, we used to do it. So I came back from USA trips, 2-3 trips, and I got disgusted, Kaisala, we should have a Siam. So I talked to Kanti Gada, who is an X-ray supplier, and he gave me the offer. He says, sir, you give me 1 lakh of rupee. This is somewhere around 95, which was a big amount. You give me 1 lakh of rupee, I can make a Siam, whatever it costs, I'll take it from you. If I can't make it, sorry, your 1 lakh is gone. And I agreed. And 1 lakh in those days, you know, it was a big amount. I didn't have a huge practice also, but somehow there was a kida in the brain that I should have it. And he made it. He charged me some 3 lakhs or 3.5 lakhs total, and went on updating as it came in. And he showed that as a model Siam to lots of people, which I asked for a commission of mine, ke sala tu dikhata hai, sabko bechta hai. And he sold many of them, and you know, I think we know very well that the Siam started that time. That time there was only 1 or 2 Siams in the country, I am told, which were non-functioning or functioning and all, and this is how I started. And that first Siam which I had, I'll tell you a small story for that. One of the rich Arab had the femur nail which was extraction was being planned, and senior surgeon in the city had tried it for 4 hours, done the femoral osteotomy and gave it up. This is the patient who came to me, and it came to me only because he says, Dr. Tanna is a Siam. So from Taj Suite, where he was staying, he came to my cheap nursing home, single room, and I could see the K-wire which it was done. It was stuck up onto the lower end, because being a straight K-wire, it was inside into the cortex of the femur. I could see that in the Siam. So I went there, smallly coiled it out, in 10 minutes time the nail came out. And that was the beginning. That was the beginning of my Arab practice. Huge amount of practice which I could get from Arab. And UAE Consul General came to see that patient because it was his friend, so I started a UAE. So as what I'm trying to put it is, your money which is spent in equipment is never wasted. From somewhere you will get the benefit, which is probably we don't consider it when we buy it. Quality of a surgery and decision making can make a difference in a good Siam. This was the fracture, And you can see this is that excellent C-arm which is there now. You can see the trabeculae. You can see the fracture. There was a distance, so that the whole decision was done properly. I feel that this was the fracture line, this was the fracture line, and if I put in the nail, this is the one which is going to come out. And if I put in a blade plate, this is the one which will come out. So because of this quality of the C-arm, I could make the decision. I made the DHS and patient was 100% normal. So this quality of C-arm will also decide what surgery you do. Here is the second one. Again, you can see the quality of C-arm, trabeculae seen, same planning. This is the one which I thought will give a problem here. So I went ahead and did the blade plate and not a PFN, and this became all right. So that quality of a C-arm will give you a good guide onto it. This, even for the spinal surgeons, a lovely C-arm can be the biggest boon ever you can think of. Hip-knee axis with the C-arm, the way I do it, is very important to establish an axis, which we can do it. We try to do it with the quartry wire, which is not a very good system to do it. Because when you do the quartry wire, it goes on bending and you go on straightening it out, and you will forcibly put it into the tibia, into the femur lower end. It doesn't really work out all the time because it is not straight all the time. So the quartry wire to me is not a very good system. I feel now I have this TKR alignment jig. This is the TKR alignment rod. I got it done. It's very simple. It's being done by the local people. And this is the one how I do this with the C-arm. With a good C-arm, you can really get the whole alignment properly done. And this is very important for those valgus varus deformities. And you can get the perfect alignment there. And it is also the most important for this high tibial osteotomy, where this rod, which cost almost nothing to orthopedic surgeon, the cost is hardly anything to this. This is the one which will give you a good alignment. And 3D imaging in C-arm. I think in a Saifi hospital where I'm working, one of the spinal surgeon is using this 3D imaging. And it is like he takes these images and then he doesn't have to go on doing the imaging all the time. He does it without exposure. So I think this is also a wonderful thing. And that C-arm is there in Saifi hospital, except that one surgeon, Arvind Kulkarni. None of us are using it. Somehow only because we haven't entered in it to find out how it works. So this is the one I think, in spite of the fact there, and in spite of somebody like me who is so curious for all the things, I have not been able to enter. So still we are doing it in a normal ways. So even if the equipment is there, we don't use it. It is like an iPhone. It has got so many qualities, we use only 5% or probably not even 5% of the qualities. So try to use it in the best possible. In conclusion, learn yourself how it works first, so that if the problem, you can handle it. Now, most orthopods who have space, that is outside Mumbai, should have 2 C-arms, one as a standby or 2 at a time. It can be used in AP and lateral. I have seen it being used. Because 100% of the trauma surgery needs C-arm, and most others, ortho procedures, 70 to 80% need C-arm. If money no issue, buy the best available. If you are a self-made, most of us have been through this. Our first car is probably the cheapest second-hand car, Fiat, Maruti, or Ambassador. Once we get money, we buy a sedan, Honda, Maruti, and everything. And once more money comes in, some of us buy Merc, BMW, or Honda, Audi. But top of the ladder car cost, we spend 40, 50, 60 lakhs for the car. But most of us do not spend 40 lakhs for the best C-arm, which is going to be used and going to make a lot of difference in our surgery and our pleasure. Thanks. Never trust anyone whose car is more expensive than the C-arm. Thank you very much.